Alright, so we're just doing an assessment of the head and face. So I'll have you look right at me, and I'm looking for different shapes of the skull and abnormal findings between the neck and the face, seeing if there's any torticollis of her head leaning to one side or the other when she looks straight at me. I'm looking at the face shape, trying to see if everything's symmetrical and proportional to each other. Looking at the color of the skin, looking for maybe any malignant moles or acne or anything that might be showing, any masses that could be in the neck or parotid gland. Looking at the eyebrows for lateral 1/3 thinning that could suggest hypothyroidism. Looking at her eyes for any signs of ptosis or Horner's. Also looking at the hair, trying to see if there is any alopecia or any thinning of her hair. And then go through for feeling the head for any irregular, maybe lesions or masses. Let me know if there's any pain with any of this. And while I'm doing that, I can also move the hair out of the way, looking at her scalp and looking for any nits or anything that could be in the hair. Okay, everything looks pretty good. So just went through and palpated through the head looking for any masses or any lesions that could be showing any abnormal findings that could be congenital or maybe post-trauma. Now we're going to move on to percussion of your frontal and maxillary sinus. So I'm just going to be tapping underneath your eyes and then just above your eyebrows. Let me know if there's any pain. Any pain with that? Any pain there? Pain? Any pain there? Okay, so that all looks good. And then we're going to do a cranial nerve 5 assessment. So I'm going to have my fingers running above your eyebrows, along your cheeks, and your jawline. And I want you to let me know if they feel similar to each other. And during this test, I'm going to have you close your eyes. Okay, so go ahead and close your eyes. Does that feel similar?
Mm-hmm.
Does that feel similar? Does that feel similar?
Yes.
Okay. And then for a cranial nerve 12 assessment, basically motor function of the face, could I have you wrinkle your forehead? Could I have you puff out your cheeks? Can I have you smile? And frown. Good. So everything seems to be working. And then for another couple special tests is going to be listening for a temporal artery and orbital artery bruit. Okay, so I'm just going to have this, I'm going to have it right on the temple of your head. Just go ahead and sit there and breathe normally. Okay, and then listen to the other side. Okay, now we're going to do your eyes, so I'm just going to have you close your eye, and I'm just going to have this part of my stethoscope just barely sitting on top of it. Okay. Okay. Going to the other side. Good. And I'm just listening to see if I don't want to hear anything, but if I do hear kind of a whooshing sound or anything like that, that would be basically a sign for giant cell arteritis. All right. Thank you.